Hi, I'm Bornali Patachari. I'm a consultant pediatrician at Pune, and I thought today I'm going to talk to you all about the two white elephants in the room. The first one is that is there going to be a third wave of the COVID 19 pandemic? Well, the answer is yes, because pandemics don't have a sudden death, it fades out, and we are kind of coming nearly to the end of the second wave. It's still there, mind you, it'll take some time to go, and we might have a little break of a couple of months, and then we will have a third wave. When and how severe is very difficult to predict. But if we go by the Spanish flu, the second wave was the worst, and the first and the third wave put together was the second wave. So we should hope and think that here also, when the third wave comes, we know that it'll probably be less than the second wave. But what happened in the second wave is that we thought it's gone, right? And so, especially with the young people, they were out socializing, they were in the gym, and many had to get back to work. The mask was dropped and the social distancing forgotten. So, in this, the denominator, the number of cases in the second wave was huge because the variant or the mutant was more transmissible. But it's so the younger ones got it. And the younger ones, even when they were spiraling, they woke up a little late because they can't get it right. It is the senior citizens or the ones with the comorbids. And they also forgot that some of them had obesity as a comorbid, and which was something really sinister in COVID 19 for the young people. So now the simplistic thing is that first was senior citizen, the second was a young adult, so this time it's going to be children because they are not even vaccinated. So the parents are paranoid because one, they are very used to their children being vaccinated, and here they feel I've got the vaccine but my child hasn't. Globally, the symptomatology of COVID 19 in children is uniform, and which is that 95% of the children are asymptomatic or mild, and it's just 5% which is moderate to severe. So, when the vaccine is being produced and not in such large quantity that every citizen in the world can have it, the ones who might succumb are getting it first. That is why children will get it in time, but at this point of time, it's you and me who need it more, and you should be vaccinated. If every adult gets vaccinated, where will the children get it from, too? Now, and also what happened to the young adults, that they took it too casually. Well, parents, the simplest of parents, are so vigilant when it comes to any disease for their children. So I'm sure you will be with your pediatrician and you will be guided right through. You've heard a lot on symptomatology in COVID 19 in children, which is very similar to the adults, except that they don't get the severe disease. Now, here, let me tell you that the population 0 to 18%, which is the pediatric age group, 0 to 18 years, sorry, which is the pediatric age group, forms 40% of the total population. And in COVID, people who were admitted for COVID 19, that is, who got moderate to severe disease, only 5% of them were children. Actually, 8% of the total bulk of the COVID 19 disease were children. So you see that children are far less affected, one, and even when affected, the severity of the disease is there in a very small percentage of children. Now, of these children who were admitted for COVID 19 because they had severe, 2% of them succumbed. And 40% of these were the ones who had a comorbid like diabetes, obesity, severe anemia, severe malnutrition, chronic renal failure. Now, a lot of the states have a pediatric task force now in place that in case also the COVID-19 third wave affects children, please do not worry. The intensive care units of the pediatric setup is ready. If there is, we are not going to be caught on a wrong footing. It is not going to be that our children die who is, because there is no oxygen and there is no intensive care backup support. But will they need it? Chances are less. There has been study done, and with AIMS Delhi they've just put it out to the public, and this I'm sharing that with you, that they feel in the third wave too the percentage of children who might need admission because of COVID-19 would be 5% of the total number of children suffering with COVID-19. And of this number of COVID-19 children who are hospitalized because of the COVID-19, only 2% might succumb to the disease. So if there are 1 lakh of children who have COVID-19, 500 might need hospitalization, and of this 500 who need hospitalization, only 1 to 2 might succumb to COVID-19. So COVID-19 will still remain a disease where children will be spared. So this is the mapping globally, but still, just the way the hypothesis was that this is going to affect the children more, but putting into data all the data into place, this is what the prediction is. So parents out there, do not panic, but stay well informed, be in touch with your doctor if your child takes ill, and please remember, even if you are vaccinated, you still need to mask up and you still need to avoid crowds. So if you keep yourself protected and you don't bring the COVID home, your children will stay safe. Bye, take care and be safe.